Welcome to the Group Dentistry Now Show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
Welcome, everyone, to the Group Dentistry Now Show. I'm Bill Newman, and as always, thanks for joining us today. We really appreciate it. We have two guests that we are proud to have on the show. Whether you've been to a DSO meeting lately, you may have seen them there before or not, but you're going to get a chance to really get to know them today. Thank you to Membersy for sponsoring this podcast. Couldn't do it without you. And we have the CEO of Membersy with us today, Michael Shuman. Michael, welcome.
Thank you, Bill. Thank you so much for having us. Happy to be here.
And Michael is kind enough to bring on Marcelle Parrish. She is the Chief Marketing Officer for Aspen Dental. Marcelle, welcome to the show.
Thank you. A pleasure to be here.
Great to have you both. And we'll start off with you, Marcelle. Love to get a little bit of your background. And then if you wouldn't mind, most people know who Aspen Dental is, but maybe you can get us up to speed on what's currently going on at Aspen.
Hey, Bill, thanks so much. It's a pleasure to be here. My background is primarily in direct-to-consumer digital businesses with large brands. I started off at Johnson & Johnson, went to eBay, and then previously at Ralph Lauren. But what I loved about Aspen was it was the opportunity to combine a lot of the digital and marketing expertise to create and be part of this powerful brand. Aspen has done an incredible job over the last 25 years creating a branded network of dentists that provide incredible access to care. They break down the barriers. And when I met with the team here, I was so intrigued by the DNA that was so core to Aspen and that purpose-driven essence. And I felt like this was like the perfect place for me to be. I continue driving an amazing brand and connecting with patients in a way that I hadn't been able to in my past. It was much more direct to consumer. So this feels more personal. It feels much more connected to the purpose of Aspen. So it's been an incredible 2 years, and I'm excited for many more here.
Michael, maybe a little bit about your background, CEO of Membersy. Can you talk a little bit about how you got from, maybe just short bio and then, where you are now, and then talk about Membersy.
Yeah, I would be happy to. So I entered the health benefits arena about 13 years ago. I previously worked for a health benefit administrator in the Dallas area and took on the opportunity to join Membersy back in 2016. And we, in a lot of ways, feel like we've been at the forefront of the membership movement. I had the opportunity to join originally as the executive vice president of sales and the partner success side of the business. And ultimately had a chance to become the CRO over the span of a few years. And most recently, last year in April, I was named CEO. And it's been just a heck of a run for us. We've been so excited to continue our mission, which is in some ways very similar to Aspen's, which is providing quality access to affordable dental care. And we've been fortunate enough to partner with a group like Aspen and various other DSOs across the country to help facilitate that access to affordable care. And we feel as though it's been a great mission, and it continues to be a very hot topic in the industry today.
Yeah, it sure is a hot topic, and I think it's great. We're going to talk about the impact of dental memberships for dental practices in DSOs. So I like the title of this, Growing Together, the impact of dental membership. Perfect. And we have both of you here. We have Membersy and we have Aspen. So I would love to focus on a couple of questions here. And Marcelle, we can start with you. What current trends are you seeing in the dental insurance market and that impact that's had on your patients?
Yeah, Bill, it's a great question. I think what we're seeing more so than ever is cost is truly a barrier to care. Over the last 25 years, we've seen this become an issue, and patients are now more than ever delaying care, having more pain, more cost associated with not being able to get the care they need because there's a lack of insurance. And when you look at the state of America, over 76 million Americans don't have dental insurance. And our research shows that because of that, dentistry is the number one skipped medical appointment out there than anything else. And for us, it was so important for us to consider, how do we break these barriers down? How do we really find a way to service our patients that don't have insurance? And so whether it's through giving back with some of our larger programs of days of service, where we've given about $22 million plus of free dentistry service to veterans and their family members in need, we wanted to take a step back and hear what our doctors needed to help support their patients. And for us, Membersy made a lot of sense, because a lot of our patients were saying, how do we get this care without delaying?
Thanks, Marcelle. Michael, I'd love to get some feedback from you as well. What are you seeing across some of your customers? What are they saying to you? I mean, the membership plan seems like a great, not just alternative, but a great, really option for people that don't have insurance, or maybe do have insurance, but are looking for maybe more coverage.
Yeah, that's a great question. And Marcelle touched on the number of uninsured patients across the country today, and it's an ever growing number. When we first started the business back in 2015, the number of uninsured was roughly 30 to 35%, which has grown closer to 50% today. We had the unfortunate situation earlier this past year where there's so many employers that unfortunately had to make cuts, and therefore there was a continued to be a growing number of uninsured patients across the country. You now see a trend going on today where there's hundreds of thousands of individuals who are going to be unfortunately potentially losing their Medicaid coverage as well. So the membership program is certainly an opportunity to help fill that gap and bridge that gap from the uninsured to the insured. And ultimately, what our partners typically see is a different change of behavior. Oftentimes with the uninsured patient base, oftentimes, unfortunately, it can be a one and done type of situation with those patients, where they're looking to come in, get their routine work done, and off they go. But membership programs have the opportunity to create more of a loyalty mechanism to keep those patients coming into the practice for the long term. And ultimately, the biggest thing is we want to ensure that we also provide an opportunity to help close treatment in a more effective way for the groups that we work with. And that has certainly been at the forefront of the success around membership programs today.
And Michael, I just want to touch on that really quickly, because you're exactly right. The compliance is so critical, because so often our patients are just come in and they were having a quick emergency, and because they can't afford the treatment, they just leave. And then that problem becomes worse and worse. And really the cost to them increases over time. It's truly a health crisis. And to your point around that membership aspect, when they feel that they have the ability to come back in, complete that treatment, it really solves a multitude of problems. So I think that loyalty aspect is something that's so critical for us at Aspen as well.
Marcelle, you mentioned earlier the 76 million Americans that don't have dental insurance. So at Aspen, are you seeing or hearing from your patients more often that they've either don't have insurance, maybe have lost it, and are looking for different options? What are you hearing out there from your clients, your patients?
Absolutely. It's really from our doctors telling us that more and more patients are coming into the office without insurance. So we're seeing more of our patients finance more so than ever. And there's a lot of trepidation around, I have a huge treatment plan. How am I going to afford this? And so in talking to our doctors, they've been asking us, how can we find a way to help these folks that don't have insurance? And so when we heard that across the board, and especially from not only our doctors, but the office staff who, connects with the patients too on a more intimate level sometimes, where they're saying, look, I really can't afford this yet. And how can I delay, but I want to pay for it. I don't have insurance. I think a lot of people in the economy have lost insurance, but also given up. When you think about things that, if you're trying to save money, one of the things you give up first is dental insurance. It's too expensive. And so finding a way for us to help these patients who've lost insurance, who don't have access to insurance or have put it off was really critical.
So again, building off of what you're telling me there, Marcelle, it seems like this is an interesting time. If we look at how I think things have quickly changed with the economy in the past, let's say, year, 18 months, what would you say, and Michael, I'd love to get your feedback as well, timing-wise, there's some of our audience may be thinking, okay, we either have a membership plan that we're not utilizing well, or we don't have anything. Would this be the right time to really implement a membership plan?
It's a great question. And, the question is, as you came out of COVID, we were seeing more and more people asking for this. And our doctors were saying, hey, we need some sort of solution. And so we started investigating this just over a year ago because we wanted to ensure that we gave the best solutions to our doctors to provide that access to their patients. And so for us, we tested this. We are very methodical, very thoughtful in how we roll things out to our offices because we want to make sure it's easy. It doesn't add complexity. That's a huge aspect that we think a lot about for our doctors, making things as simple as possible and as easy for them to sort of integrate into their daily operations. And so we tested about 100 different offices. And what we saw across the board was this was easy. It was much simpler than, adding insurance in some places for the customer and the patient to understand. So for us, after that test, we heard an even louder cry from doctors saying, hey, we want this in our office. How quickly can we get this for our patients? So it's been really nice to see that. But again, to your point, the right time is really after we test it, we make sure it's the right thing for our patients. It's the right thing for our doctors. And then we scale across this vast network that we have.
Michael, what do you say to that as far as timing wise? With dental membership plan, are you getting more requests from DSOs and group practices out there looking for some options, patients coming to them without insurance and looking for access to care?
We definitely do. I'd love to say that the time is now. I think the time was a couple of years ago in a lot of cases, to be honest with you. But with that said, the timing has to work for the group that we're working with as well. And I say that only because, in a lot of ways, at least our partners, we take on the brunt of the implementation process and the workflows and creating, the onboarding process for the membership program. But that said, it is a two-way street. We need our partners to be ready for that as well. So just in terms of how our partners are set up and ready to scale, that's a big indicator whether or not they're ready to take on a membership program as well. Now, in general, absolutely the time is now to create a membership program. And you might see oftentimes that there's DSOs and DPOs out there in the industry that they might even have disparate membership programs across multiple offices. But a partner like us has the ability to help streamline that process and in a lot of ways standardize the process while still allowing autonomy and flexibility across offices and regions and states and so on and so forth. So the timing is absolutely now from a consumer standpoint. But that said, the partners need to be on board with their own timing as well. There's a million different priorities that are going on in the industry today, and that's certainly something that we all understand. And so the timing has to be right for the partner in that regard as well.
Yeah, great point. And you mentioned standardization a couple minutes ago. So at Aspen, you have over 1,000 dental practices, correct? I think it's over 1,000 now. So
and growing.
So standardization across 1,000 locations, 1,000 plus locations, can be challenging. So can we talk about how you ensure that consistency? I'm sure Membersy can talk a little bit about how they help you, but Marcelle, talk about that because I know that's super important to Aspen. You're branded across all locations, which is not. I mean, it's not unique, but it's not common across dentistry. Some, are branded, and each location kind of does their own thing. Aspen's different. You really have a lot of standardization and consistency. So talk about that and the importance. And was it easy to do that?
Well, I think you're exactly right. Aspen is unique in that we are the largest branded dentistry organization in America. And it's been important for us to take that route because for us, the brand is the most critical thing. And our brand is our patient experience. And so to your point, driving that consistency across all of our different organizations, from our office staff to the recruiting to the collateral, ensuring that patient experience is the best it could possibly be is critical to who we are as a brand. And we enable our doctors to do that every day. And we do so through training, ensuring that we have the right training, not only for our office staff of how to connect with our patients, but also for our doctors. Mentorship. We do doctor journey training where they come in and they go sort of the 101 doctor journey where they're learning not only different skills from implant placement to how to place how to create their first crown and bridge implant to spending time in our Chicago office where we have extensive training facilities for them. That consistency, Bill, to your point, is so critical to the experience that we are able to deliver to our patients. And so for us, when we rolled out this membership program, we want it very connected to Aspen and how we delivered that care to the broader network that we have. And what we liked about Membersy is that they branded this for us. It is really all about the Aspen Dental Savings Plan. And for us, that was critical. We didn't want to bring a third party in. We really wanted this to be from us and delivered in a way that we knew the experience would live up to the standards that we have for our patients.
Michael, talk a little bit about how you can assist with consistency and standardization.
Yeah, absolutely. One of the biggest reasons why membership programs were created and have become so prevalent is because with the uninsured patient base, there was an incredible amount of inconsistency in how they were treated and presented with treatment ultimately to move forward and continue with their dental work. So what membership programs have really enabled is standardization across the board in terms of how uninsured patients are treated at the time of service. It also provides a baseline in terms of cost of how they are going to be charged. Oftentimes, and this isn't necessarily related to Aspen or any of our partners, but years ago, before membership programs had become so prevalent, there are so many times where there's price negotiation on treatment, some verbal discounting, maybe just one-time discounts, things of that nature. And it created more of a shopping around culture as opposed to a loyalty culture. So membership programs have become extremely prevalent because it does provide consistency across the board. And then there's, of course, ways that we can help enable that through our trainings and our partnerships in the implementation and onboarding process for all the practices that we work with. And we do so in collaboration with our partner to ensure that we're adhering to their guidelines and ensuring that we work hand in hand with them to preach that across the board.
Thanks, Michael. Marcelle, I forgot to ask you this question, but when you were going through the decision-making process and looking at different membership plan options, what went into that decision-making process and how did you ultimately partner with Membersy?
Yeah, absolutely, Bill. It's a great question. For us, security of our information and our patient information is critical, and compliance across states from a legal perspective is unbelievably important to us. And so when we were looking at the options out there, and what we found with Membersy was they were very focused on ensuring that security and that patient confidence that their information would be protected. And so for us, evaluating a partnership both on security, both on HIPAA compliance, both ensuring that they had that expertise as well to really know how to go into market was important. We wanted someone who'd done this before, they did it well, and they really first and foremost protected patient data. And for us, we connected with Membersy and they hit all across the board, all of those things that we were looking for.
Thank you, Marcelle. Michael, question about from an administrator perspective, the person at the practice or at the group that's going to be handling this, what do you offer somebody like that? Because going from not having anything to onboarding and the education, the training, whether it's one location or over 1,000, talk about how Membersy can really help an administrator of a plan.
Sure, absolutely. We feel as though we're likely the most experienced in the industry at this point, just in terms of scaling with DSOs. We provide a full implementation timeline and a process right from the get-go. We usually kick it off with a nice implementation kickoff call and go through the entire process in terms of all the deliverables that are needed from both parties. We always preach to our partner that we're going to take the heavy brunt of the implementation process. But that said, oftentimes our partners are as involved as they want to be throughout that process. And we certainly want a very engaged partner to ensure that we're very collaborative through the implementation process, and we're hitting all the tough points that we need to in the implementation and the training as needed. We want to make sure that we also handle things from an operational perspective with our partner, hitting multiple layers within the organization, whether that's dealing directly with the DSO or DPO entity themselves, all the way to their regional managers, their regional VPs, down to the office managers and front desk staff, treatment coordinators, et cetera. So we hit multiple layers within the organization to ensure that everybody is well equipped to offer the membership program. It's consistent across the board, and they're set up for success.
And I would echo that, Michael, in terms of what we've seen is sometimes some of our offices needed a little bit more help, right? It was not just, some of them are like, yep, got it, no problem. But whenever we needed a moment to say, hey, Michael, we have some folks come in and train our office again after rollout, just as a refresher. That was something that we really valued in terms of ensuring that our offices felt like they were supported across the board. And so for us, it wasn't just the beginning. It was also, there was a midpoint during sort of that implementation aspect where the offices might need a little additional support. We would call in Membersy to really help those offices get them back to where they felt more comfortable. So it wasn't a one and done.
Yeah, I'm really glad you brought that up, Marcelle, because it's not a one and done. Oftentimes, it's an ongoing process. And you're going to have the unfortunate situation where you might even have a little bit of churn there at the office level throughout time. And so we not only hit them with the initial training and an onboarding process, but we have a partner success team that is ongoing, working with the office managers and the front desk staff to ensure consistency across the board. And to Marcelle's point, if there's any offices who aren't picking it up as quickly as others, we put a little bit more of a focus on them and ensure that we get them in a good spot and ensure that they're well equipped to offer the program and very comfortable in doing so.
As we get to the end of the podcast here, I had a couple additional questions. Marcelle, how would you say you measure success with a membership plan? How do you look at that and say this is working really well? I know Michael talked a little bit about it, where you might have some, inconsistency, whether it's a new staff member or somebody that needs to be trained up a little bit. But talk about, how, when you look at the plan, how do you measure that success?
That's a great question, Bella. And I think it's important for our doctors to hear as well, because for us, the first and foremost that we reach out to hear if this is successful is from the doctors. We're in a constant communication with our offices to ensure, is there anything going wrong? Is there complexity that's been introduced? So when we looked at what this success looked like for us, it was, are the doctors happy? Is this working for them? First. Second, are patients getting more access to care? And that was what we really saw shift, is our uninsured patients were saying yes today to the treatment because we offered this plan. And for us, that is success. It goes back to our core DNA of breaking down those barriers. As we were talking earlier, cost is a significant barrier, especially to the uninsured. This solved that problem for them. So when we think about how we define success, it was really seeing those patients that were uninsured say yes to their treatment plans.
No, that's great. Michael, what about what are you seeing with some of your beyond Aspen? How are other groups measuring success? And then any thoughts around KPIs? What groups should be looking for? What do you typically look at with a membership plan to see if it's really working well?
Yep. Well, we measure success based on how our partners measure success, and so ultimately, we're not going to be successful unless they're successful. And oftentimes, it's very much related to case success, case acceptance, and ultimately revenue. I think there's a little bit of a misnomer sometimes in terms of a membership program. I know that there are groups and certainly doctors who are concerned about discounting their fees. But ultimately, with a lot of partners that we work with, we oftentimes see double or triple the revenue from these members as opposed to the uninsured cash paying patient base. So I would say the main KPIs to track certainly would be case acceptance. We oftentimes like to shoot for a target 30% or above in terms of improving that case acceptance rate. And ensuring that we get a certain amount of visits throughout the year from these patients. So really the KPIs are mainly around loyalty and overall revenue for the practice that we're able to generate.
Thanks, Michael. On your end, Marcelle, any thoughts around how you talked about how you measure success, but what do you typically look for, and what are you seeing in practices that have implemented the membership plan well?
Well, I can't give specific details, but what I can tell you is that where we have implemented the membership discount card for Aspen across all of our offices, we've seen definitely an uptick for uninsured patients saying yes to care. And what I think is really powerful for us is our doctors have asked for this, and they wanted to ensure that we could provide care to the uninsured in a way that was simple, and it made it easier and really lived into what they want to do best, and that's provide the care to their patients and do so in a way that genders that loyalty, that compliance to the treatment plan. Because Michael, you're exactly right. So often patients come in and they come out and they don't feel that connection. And at Aspen, you'll hear our patients talk about the connection they have with their doctor. And that's the connection they have with the entire office, actually. And this is just one more tool with Membersy that we've been able to provide them that enables them to take care of patients in a way where they keep coming back. So I hope that answers the question. We're pretty excited with the rollout of Membersy for our doctors, and can't go into detail, but we've been pretty pleased. Otherwise, I wouldn't be here with Michael today.
That's a great point. So, So Marcelle, it would be great if we have somebody listening in that is either a clinician that would like to find out more about Aspen, could be somebody on, whether they're on the an office manager or somebody like that could be listening in. How do they find out more about joining the Aspen team?
Please have them contact John Murphy. I think he's actually been on your podcast before. But
yes,
I'll give you his email address. I can't tell you, I've joined this company 2 years ago, and I continue to be impressed with how powerful this community is. This is like an Aspen family. There are so many doctors providing such incredible care to patients that I feel so proud to come to work. And I would love to have even more folks join our Aspen family. If you are interested in joining us, please visit careers.aspendental.com, enter your information. We would love to welcome you to the family. It's incredible place, and I'd love to meet you personally as well.
That's great. And you mentioned it earlier, but if you'd like to give some more detail, you talked about your Chicago HQ, and you talked about the training center there. Dad, I had the opportunity to visit the smaller one. So you outgrew the first one in like a year, and then you, I think, doubled or tripled the size of it. But I was pretty impressed with the first one. So that's an opportunity, obviously, bringing a lot of the clinicians or all the clinicians there to learn, and the facility is incredible. But if you have any detail on that, I'm sure the audience would love to hear about that.
Oh my gosh, Bill, I'm so excited. I am looking out right now at our TAG University. It's a university we've created to really focus in on every aspect of the doctor's journey, of our field staff's journey, how they can help connect with the patient. There's training from a clinical perspective. We've just created a new OCC, which actually doctors come in and they practice and they learn how to do implants. I just was sitting in the other day, and it was incredible to see a first year come in who was a little nervous, and you could actually see on their face, they were like, I've not done this before. And to have the guidance and the membership our doctors were providing to them. And I have to tell you, it was actually very moving to see that the new doctor come out of that procedure so confident and feeling like he could really do this. So I've been just impressed with seeing it firsthand. So our commitment to our doctors is we've built this facility. You'll come in, you'll get to know every aspect of the training facility. We have ongoing trainings, not only in office, but also virtually. Our doctors will come in and train. We have mentorship programs. And what's been really nice to see about our office is that we're really leveraging the strength of the network, of our family, to bring that expertise into our clinical offices, into our clinicians, and into our field staff in a way that's very powerful across the network. So I'm excited. Please come visit us. We'd love to have you.
Thank you, Marcelle. Michael, final thoughts from you. If somebody is listening, whether they have an emerging dental group or whether they are a larger DSO or DPO, how can they learn more about Membersy?
Please visit us at membersy.com, and you'll find all the information that you need there, and also have the ability, of course, to schedule a demo with one of our team members. That would be absolutely the best way to learn more about us. And just a quick little plug here. I mean, we here at Membersy, we ultimately just pride ourselves on being an extension of your organization. This is your program, and you have the ability to control your own pricing destiny with us. And we are in the background ultimately to help facilitate the membership movement, and can do so through our operations, through our technology, through our compliance. And of course, our experience in helping scale with the groups that we've worked with up until this point. So please reach out to learn more. I'll certainly be at some of these upcoming conferences throughout the rest of the year, and I would love to meet every one of you. And lastly, I'd just love to say thank you so much, Marcelle, for joining today. You and Aspen have just been an absolute home run partner for us, and could not ask for a more engaged partner. And it's just been an absolute pleasure.
Oh, thank you so much. And likewise.
Well, thank you to Michael Shuman, who is the CEO of Membersy, and Marcelle Parrish. She is the Chief Marketing Officer of Aspen Dental. Thank you both for joining us on the Group Dentistry Now show. And until next time, we appreciate it, whether you're watching us on YouTube or on groupdentistrynow.com, or you happen to be listening to us on Apple, Spotify, or Google. We appreciate you tuning in today. Until next time, I'm Bill Newman.
The Group Dentistry Now show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today, and please tell your colleagues about us.